Hi, everybody. Welcome for this podcast. And as you know, mostly this channel is about spirituality, but spirituality cannot be complete uh, without really focusing on your health. Many people separate spirituality apart from health, apart from the body, separated from the mind. But that's not true. Holistic spirituality is more about the mind, the spirit, the soul, and the body. And so I felt it is very important and vital to talk a little bit more about our body, our health, our diet, a little bit about exercise and all that stuff, which is very, very important if you really want to be a spiritual person or at least be connected to God. The body is very important, and that's where the scripture also says, the Bible says, your body is the temple of the Holy Spirit, and we need to take care of our body. So to really talk about health and diet and exercise and all that stuff, we have expertise on board. So we have Kiran Mathew. Kiran Mathew is a professional medical doctor. So he's going to introduce more himself to each one of you. So Kiran, welcome for this podcast. Thank you for accepting the invitation. So
Thank you so much,
let's go dive
Kiran.
deep into this podcast. So, Kiran, tell us something about you. Where do you practice? What are you doing? And what
Yeah.
kind of doctor are
Uh,
you?
Hello, hi everyone. I'm Dr. Kiran Mathew. I'm from Hyderabad. I finished my medicine in Karnataka, Davangere. Then I started working in ICU and emergency care in Apollo Jubilee Hills. After that, mm, through my research, I love
Mm,
really research. So I was looking for a like very good place to research about nutrition, uh, about the diet,
mhm.
about spirituality. So I decided to come to Sikkim. Right now, I'm practicing in Sikkim,
Okay,
in a small place, Singtam. I'm sitting in OPD basis, and yeah,
awesome. Awesome. So, Kiran is also into spirituality, and we are friends for a long time. So,
yes,
Kiran,
yes,
let's dive deep into the main topic. So,
yes,
uh,
yes.
we are talking about diet. Okay, now there are so many
True.
diets out there. People prescribe
Yeah,
to patients
yeah.
and all those things. uh,
True.
what do you think, what would be the ideal diet for a person to live a very healthy life?
Okay. On my personal experience that I seen with the patients, initially people was skeptical about when I
Mm,
started speaking about low carb diet.
mm,
Usually, low carb is something like you don't take no vegetables, cut off all the flours,
mm,
and no processed food, no
mm,
sugar.
mm,
So when I started sharing about something about low carb diet, they were
mhm,
not agreeing. But
mm,
initially,
mm,
uh, when I uh, given even more depth
mm,
about this
mm,
and how this can bring total healing to the body
mhm,
and how you can reverse the diabetes, they
mhm,
were like skeptical, but they started, but
mm.
they saw a great
Results.
results. Yes, results. And
Awesome.
yeah,
Okay, so what are the macronutrients a body needs actually?
macronutrients.
What are the macronutrients?
Macronutrients are like we have this uh, there are something called vitamin B, vitamin C,
Yeah.
and These are water soluble, and there's fat soluble, vitamin A, D, E, K,
Yeah. So those would
and
be
these
a
are fat soluble.
micronutrients. Those would be
These are
micro.
macronutrients.
Yeah. What about
No,
macro?
these are
These
oh,
are macros? Are these macros?
these are macro.
Okay.
These are macronutrients, and micronutrients are like all the trace minerals
Okay.
that you get: selenium, zinc,
Mm-hmm.
iodine, uh, all this is copper,
Okay.
cobalt,
And
boron.
what
Yes.
about protein, fats, and carbohydrates?
Okay. Protein, through food we get. This is the most important part of nutrition. Is
Hmm.
everybody know about protein, fat, carbohydrates, but they don't know how exactly it works.
Okay.
Especially when
So
especially when you talk about
these are
yes,
the before we get into what I presume you are going to speak about. These are the
yes, yeah,
main energy nutrients, right?
yes, that is true.
So the
Everything
body.
gets through. Yes, everything macro and micro gets nutrients get through this: proteins, fats, and carbohydrates.
So and fiber also.
Yes, fiber.
Okay, so these are the main things, main nutrients. So all the other nutrients are in this main nutrients, right? Like uh, carbohydrates, fat, and proteins.
Yes,
Okay, so now out of these, now you are talking about low carbohydrate diet.
true,
So when you say low carbohydrate diet, so you're literally reducing your carbohydrates very low,
true,
and you
true.
will have two major nutrients, that is going to be protein and fats.
Yes, protein
So
and
when
fats.
you
Yes, that
reduce
is true.
carbohydrates, the obviously a question will come in a person's mind. Uh, why are we reducing carbs so much? Is it not going to affect our body or health?
I say no,
Okay, so like, what's the reason behind that?
because carbohydrates, it is just gives an energy. It is like
Okay,
just boosts your body, but uh, it doesn't bring. It's the major reason I avoid carbohydrates in every patient is because of the inflammation that they get, and it
okay,
increases even more sugar. More sugar,
okay,
more inflammation, more
okay,
insulin in the
okay.
body. Yeah. Awesome.
So that means I am not getting, once you are going low carb or zero
Yes.
carb, I am
Yes.
not getting energy from carbohydrates.
True.
So from where do I get my energy?
If you uh, if you start having fats
Hmm.
and protein, the body itself changes into a ketone pathway. It's called
Okay,
ketosis.
okay.
So yeah, we get through ketone energy.
Energy comes through ketone energy.
Yes. Yes.
Okay, so now many people think, okay, I'm low carb, I'm zero carb. Am I going to become weak now? What do you say? What do you have to say about that?
No, not at all.
Yeah.
No, not at all.
Why do you say that?
It's a big lie. That's what how we from childhood,
Hmm.
from the textbooks, biology textbooks,
Hmm.
science textbook especially, what I read is like carbohydrates gives energy,
Yeah.
but that has captured the minds of people and started believing only carbohydrates gives energy,
Hmm.
but that is completely false.
Okay.
Protein is the ultimate. Protein and fats are the ultimate nutrition for the health.
Energy source.
Energy source, yes.
Okay. So okay. So you basically promote people to go more on fats and more on proteins.
Exactly. True.
Okay, so that means many people have this mindset That okay, if I eat more fats, I will become fat.
No,
Okay, so
no, no, no
how
way.
do you resolve that? What do you tell those people who say that?
No, no, fats never cause. Fats are like,
Hmm.
see, first of all, cholesterol. It's very
Hmm.
necessary for our body. For if there's any damage that happen,
Hmm.
especially in the blood vessels
Yeah.
or in any part of the body, fats actually help in resolving those issues by
Okay.
reducing the inflammation.
So fat is basically turned into like cholesterol into our body,
Yes,
and that cholesterol heals if there are any issues that happens in our body.
true.
Okay. So basically cholesterol is good. That is what you're saying.
Yeah, my point. Yeah, cholesterol is really good. If it is not there, we would be dead by now.
Wow. Okay. So okay, so you are saying cholesterol is good, but what about people talking about high cholesterol and they will get heart attack through this high cholesterol and all that?
This high cholesterol, even I believe that high
Hmm.
cholesterol fats can cause high cholesterol, but on my research and how my patients started improving, I
Hmm.
found a really interesting thing that people who are having high carbohydrate diet, they are having fatty liver.
Okay.
So if non-vegetarians, people say that non-vegetarians have fatty liver,
Hmm.
then my question is why vegetarians also are having fatty
So
liver? If
vegetarians
non-veg
and vegans.
vegans, yes, vegans are
Yeah.
having fatty liver.
Okay.
Especially they say that gallbladder there'll be some problem with gallbladder if you have more of meat. But
Hmm.
even the vegetarians I see in Sikkim,
Hmm.
in out of 10, 2 patients are having gallbladder in your problem
Okay.
and fatty liver. Fatty liver is like with everyone, but they
So
are
yeah,
having gallbladder
before we
problem.
talk that's very important point that you're making. So
Yes,
you
yes.
let's for the audience who are just new to this nutrients and all this stuff, energy source.
Okay,
Let's could
okay.
you share about what when you because you're talking about vegetarian, vegan, and people non-vegetarians, which food carries more carbohydrates?
It is rice. Like you want me to like
Yeah, yeah,
rice,
just
chapati,
in okay.
rice, chapati, maida, dalia,
Hmm.
all types of flour, and vegetables, fruits.
Okay,
No, this
like veggies, like potatoes and all.
e- every type of vegetable can
Almost,
cause.
yeah, almost all
Oh,
have carbs in it.
exactly. All vegetables have carbs, and they
And
cause
what?
fatty liver.
Okay, and what about non-veg? Does it have carbs like meat, eggs?
See, yeah, protein have minimum amount, not no carbs, but they convert into amino acids,
Okay,
uh, and then very little bit amount of
okay,
sugar,
yeah,
uh,
but
but not
it's not
no.
it's negligible.
It's
It
very
very
little
less.
bit,
Okay,
very less.
and
Yes.
that's great to hear that. So basically, you are saying that people should eat vegetables which are very less in carbs if they want to, and
True.
be they must be eating more non-veg.
Yeah,
Okay,
yeah. That's what my
and you
point is.
say
Like,
that you are prescribing such diet to your patients.
yeah, I'm doing that,
Okay, and
and
what have you seen? What results have you seen? What kind of patients have come to you, and what
yeah,
results have you seen through this kind of diet to
it's kind
them?
of diet.
Hmm.
You'll be blown away with the results that I seen, and now I become. They made me a specialist now. Now
Okay.
mouth by mouth, it's a mouth by mouth publicity is
Hmm.
happening now. People are like rushing to see me, like, who is this guy? When they see me, like, oh my God, this guy is so young.
Yeah.
So especially few patients I want to talk about, like literally they came they just know my name, what I did, and here, and they just came and like they were on insulin. I was like, why you are on insulin? You don't
So
require insulin.
insulin is basically given for those who are diabetes.
Yes, exactly. Diabetes, insulin. So I
Hmm.
said, like, you no need to take insulin. It's not required. No, no, no. My doctor,
So wow, a
who
doctor
the
is saying to the patient insulin is not required.
insulin is not required, and
Okay.
his doctor, he was like arguing with me in
Yeah.
a nicer way.
Yeah.
He's like, no, no, sir. My doctor, he's very senior, 25 years experience.
Hmm.
If you should take insulin for lifelong. I
Hmm.
challenged him.
Hmm.
Take low carb diet. Just
Yeah.
follow for 10 days. If the
Yeah.
sugars are not reduced,
Yeah.
you take insulin.
Okay.
After 10 days, he followed the low carb diet, just eating
Hmm.
meat and
Yeah.
fat. Okay, fats you get ghee, butter. I told him
Yeah.
to prepare all the food with butter, ghee,
Hmm.
uh, and eat meat and eggs.
Yeah.
And if you want, just take a little bit amount rice.
Okay.
After 10 days,
Yeah.
after 10 days, he came back. He was surprised. His sugars are totally came down
So
in 10 days.
from what level to what level it just came down?
353.
And how long? 353.
353.
And so what is the normal range of sugar?
His normal range is one. Fasting should be 110, and
Okay.
postprandial one below 140.
And so 353, this was fasting sugar coming down to one,
Yes. Yeah.
to what? 110,
To 140. Like
140.
fasting was 140, and postprandial was somewhere around 180, and he was like surprised with
Wow.
the results, and he continued the diet for next 20 days. And before the diet, I want to say something about he was literally he was an anxious because insulin can cause some depressive effects. So
Mm-hmm.
after this diet, he was like, he came with cooling glasses, full leather jacket.
Mm.
He is looking, his face was shining, and I was like really happy to see him like that. He was really now happy. He's
So
not taking any medication.
you mean to say
Yeah,
he went on a diet, and when he was doing this diet, he was completely off insulin.
exactly. He
And
was off insulin.
how many years the person was taking insulin?
From past 12 to, I think, 12, more than 12 years.
Wow. So someone who's taking insulin for 12 years gets on a diet just for 10 days, let's say 12 days, and
Yeah.
remains without insulin and has healthy blood parameters.
Yeah.
Wow. That's
Yes.
amazing.
Yeah. And we checked all his parameters, everything were in normal stage. And he's like, he is so, he decided to follow this diet like
Okay.
forever, kind of told.
Wow. So this is about blood sugar, diabetes. I mean, diabetes, I think India is ranking highest in diabetes.
Yeah.
Uh, what about other diseases that you came across? You prescribed this diet.
Especially
So before you tell
gout.
that,
Yeah.
I just want to tell the viewers who are watching us. I I myself am guiding people into this diet. So the reason why I got Dr. Kiran Mathew on board is because then you guys know that this guy is an authority, expertise who is speaking up because I'm not trained professional. So I wanted every viewer to know that we are onto something that has been researched now, and there are a lot of healing. People are getting healed and getting into ultimate health because of this diet. So Kiran, you want to share about yourself? How this diet helped you first? Then we move on to the your patients,
Okay. Oh my God. It's, this
if you
diet,
want to.
yeah, okay, I'll share, no problem.
Yeah.
I've been through a lot of severe chronic, myself, I was having a lot of chronic issues, fatigueness, anxiety issues, it was anxiety issues, and I used to have brain fog, dizziness, sometimes, brain fog every twice a day. I
Mm-hmm.
used to have brain fog uh, and like I used to be even in the workplace also my focus used to be very less, memory power little bit.
Mm.
Uh, So I researched a lot. I did lot of diets. I even did intermittent fasting.
Mm.
Yeah, it worked. It reversed my fatty liver, but not my condition. Not this condition, this pain, this anxiousness. But after researching a lot amount of research about this low carb diet, I
Mm.
straight away went through this carnivore diet, this diet
Mm.
called carnivore, where
Mm.
you need to have high meat,
Completely avoid
heavy,
vegetables.
completely. I avoided everything.
Mm.
No rice, no chapati, no maida, no vegetables, no fruits. Yeah, I took fruits here and there,
Mm.
because of my little bit of carb craving. I can talk about that later. But
Mm.
so, and milk, you,
Mm.
sometimes milk.
Mm.
So after first 7 days, I didn't see any much change. But after that, I was surprised. I was shocked with the result. I was started having this what do you say, like uh, I'm not getting the word, like antidepressant effect, because I used to
Okay.
take antidepressants, where as in it's called escitalopram. I took it
Wow.
for a very long time. I stopped. I
Mm.
got that effect. What escitalopram, this antidepressant does is it boosts your serotonin. My
Wow.
that's what it happened to me. It boosts my serotonin, and I was pinching myself, and my wife was really surprised seeing this result, and she was like, "No, you need to go on this diet." Even
Wow.
I tried to like take a little bit of carb rice. No, 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 no. You're doing really good.
So
You
you mean
should
to
do
say
this
this
diet.
diet that you are saying, speaking about, or we are speaking about, and
Yeah,
I'm also a promoter
yeah,
of this diet, it
yeah.
literally gives an effect for anti-depression also, of anti-depression also.
Exactly. You will be out from depression in no time.
Wow. Okay. So now coming to your patients, what else
Yes,
now? Okay. Blood sugar levels get normal, depression gets normal, energy levels go high, brain fog goes
yes,
away. What else did you
yes.
see? Which patient, kind of patients came to you, and what else did you see?
Especially more common case in Sikkim is gout.
Gout,
Yeah,
which
vegetarians have
I
gout.
also have. Okay, I also
Yeah.
get
Oh,
gout flares, uric acid, and all that stuff.
yeah.
Yeah, go ahead.
It's like vegans are also having, and non-veg are also having. Now I'm kind of confused. Before I started this diet, I was like, what? There's something wrong with this medical field. I can't just
Hmm.
give anti-uric acid drugs like that. I just need to find the root issue. When I
Hmm.
found this issue is like the high insulin resistance caused by high carb diet, then I understood. I started telling the patients, like, nothing will happen. You just take protein, take
Hmm.
fat, less
Hmm.
carbs, you will be fine. You'll be
Okay.
healed.
Okay.
After 10 days, they'll come and they see the results, and they were like surprised and shocked. But like
Hmm.
there's a little bit of counseling, but it took time for them to understand, because it's such a uh, it has become normal for people, like having protein is dangerous. So to break that, it took time, but now people are able to get
So,
it what I'm
so,
able to say.
so let's before we go forward, let's, as a doctor, I think you shall not say should be healed. You shall say reverse. You reverse it because then you might
Yeah,
have legal issues. So okay, so basically you're reversing even gout issues. Now I personally have a lot of gout, used to have a lot of gout flares,
true. You
and
told me.
uh, that's when I used to eat non-vegetarian with carbohydrates. Okay,
Okay,
but the
yeah,
moment I go non-veg, but I reduce carbs and get very low carb. That's when I saw
yeah.
myself completely getting out of that gout flares and all those things. Now, the
Wow,
common,
that's nice.
if you go to any doctor, the one thing they will say is when you say I got uric acid or gout, they will
Yeah.
say that avoid meat.
Yeah, that is true. Every
So, what do you
doctor
have to
says
say
that.
about that?
No,
You
no,
are
you should have
saying
meat.
you should have meat
Yeah.
and go low carb.
Avoid, yes, avoid carbs. Uric acid will reduce.
Reduce. Wow. What else? What else? What other kind of patients have seen results with other disease or issues?
Right now, I'm working on. I'm waiting for the results. I'm working on a few kidney patients who their creatinine levels are high.
Hmm.
So I can see there's a change.
There's a
I mean,
change.
like not a aggressive, but there's a gradual change I can see, and they're improving nicely.
They are improving. What about blood pressure?
Their blood measure,
I
their
mean,
blood,
what about patients who come to you with
oh,
hypertension, blood pressure problems?
even hypertension, blood pressure. I initially it the blood pressure always. I don't know why, but still
Mm.
I need to do some research on it. It always took time to control the blood pressure with this low
Okay.
carb diet, but
Mhm.
it is to get reversed with diet and proper exercise.
Exercise and diet.
Diet, yeah.
Right now, just to for the viewers to know, uh, I personally have, I'm a yoga trainer also, apart from my spirituality, and I have a guy who's from Mizoram, and his blood pressure was used to be 180. Okay, I put him on a diet, and his weight was almost like 114 kg.
Mhm.
So I put him on the diet. He reduced 10
Wow,
kgs, and his blood pressure, which was 180, now has come down to around 112, 120.
wow.
Okay, and just ever since, and I would like to point out about the exercise. Ever since he combined yoga and the diet that I shared with him, he was sharing with me this very morning itself that his weight has reduced more and his pressure has come more normal than before.
Wow.
So, yeah, so that's something. When a person is having hypertension, normally doctors say don't eat meat, red meat.
Mhm.
What
Yeah.
do you say, I have to say about it? Do you think it red meat helps, non-veg helps, or veg helps?
Non-veg helps.
Non-veg helps.
Yes.
Yeah, and I think when we are talking about non-veg, we have to also make sure that the non-veg that you're having has to be low carb.
Yeah.
The
Correct.
problem is when people have high carbohydrates and also have red meat, right?
That uh, true. That can be dangerous. Yeah.
Why it can be dangerous? Could you share that
Because you like eating high meat and again taking high carb is nothing, like you're causing even more damage.
to your
Now
body?
you're like confusing, you're confusing your body.
Okay. And it's like it's causing inflammation. That's what is really causing the harm, right?
Yeah, yeah, correct. It's causing inflammation. That's true.
Wow. Okay. So I don't want to take this podcast for too long, but I just wanted to share with the viewers that Dr. Kiran is treating so many patients, and uh, they are reversing most of their lifestyle diseases. And I'm also uh, doing instructor, yoga instructor, and also helping a lot of people who come to me have health issues, and I'm seeing a lot of benefits into it. So both of us thought of to help the society, to the community. We are on board, and I want to share with everyone who are watching us that we are coming up with a program for everyone who's watching us. If you want to see health benefits in your life and want to really try out this particular diet, and if you want to try yoga also, to bring a healthy lifestyle into you, and basically this is the beginning of this year, we are providing each one of you a program where Kiran will be e- medically offering you his medical advice pertaining to any sickness or disease that you have. And I will be following up with these people and giving them and helping them and advising them how to go about into this diet. So both of us, okay, myself as an yoga instructor, and also been doing this diet for a long time, and Kiran, who is trained medical professional, will be monitoring, following up with you guys, and trying to help you guys to have a very healthy lifestyle. So, Kiran, before we finish this off, have you seen people with obesity issues also having improvement?
Yeah. Uh, Usually, I don't talk about much about obesity. The reason when I start, because obesity, they have diabetes, definitely insulin resistance. When I just give the diet,
Mm,
they actually reduce weight properly. I
okay,
seen the difference.
great.
If I tell them, it's like it's kind of if I tell them to you should reduce weight, they may make
Yeah,
mistakes.
I
So I tell
understand.
them, oh, it is diabetes.
Yeah,
You need to take proper diet. So I
awesome.
think
Great. Okay. So, guys who are watching us, if you want help, advice, consultation on reversing certain disease, especially diabetes, obesity, blood pressure, hypertension, and most of the lifestyle diseases, then you can contact us. Contact me on the number that I'm going to put in the video description below, and we will be glad to help you and help
yeah,
you reverse certain sicknesses that we think would be helpful through this diet. So, do you do uh, check with us, do contact us with the contact number that we give below. And thank you, Kiran. Thank you for your precious time.
thank
I
you,
know you're a doctor,
thank you,
and
bro.
doctors are always busy. So thank you so much for your precious
Thank you so
time
much.
to be on this podcast. Thank you for your expertise and sharing your knowledge with us. And yes, so see you guys, and live
Yeah,
strong and live long. Take care. Bye.
bye.